There are new warnings out and many people wondering if it could trigger an even bigger epidemic.
Latest numbers just coming in, 1,323 cases right now, 729 deaths. ABC's Bazi Kanani is tracking it all from Washington. Good morning, Bazi.
Good morning, George. Stringent new measures this morning to contain the outbreak. In Liberia, schools are now closed until further notice, and everyone is being ordered to stay home this Friday while public facilities are disinfected. In West Africa this morning, doctors screening airline passengers as fears mount about the spread of the worst Ebola outbreak in history.
If we don't fight it and contain it there, we will be fighting it and trying to contain it in other places.
Here in the U.S., high alert at hospitals, like this one in Charlotte. The ER closed Wednesday until doctors cleared a patient who had recently traveled to West Africa. A false alarm for one family, but not for another in Minnesota. Patrick Sawyer died just weeks before returning from Liberia.
I have 3 girls who will never get to know their father.
Healthcare providers who have come in contact with patients or in close contact with ill people are at the highest risk for this.
The concern about the outbreak intensifying just as some 50 African leaders and their delegations, some from affected countries, are set to travel to the U.S. for a U.S.-Africa summit next week. The CDC says there is not significant risk here in the U.S., yet some in the medical community urge caution.
I think we should be on alert. I don't want to cause panic, but I do think that, people do need to be concerned and pay attention to it.
The White House says the Ebola outbreak does not change any plans for the historic U.S.-Africa Leaders Summit, but sources tell us the presidents of the 3 most affected countries are canceling their trips, expected to stay home to deal with this health emergency.
A lot to deal with there. Okay, Bazi, thanks. Let's talk to Dr. Rich Bessert about this. This is the worst outbreak of Ebola ever, as we have heard, and you see these African nations really struggling to control it.
That's right. One of the big problems here, usually these occur in remote villages, and you can isolate that area and let it burn itself out. Here it was on the border of 3 countries, and so there's rapid movement of people. They've been unable to get people to go to the hospital, and they've been unable to track people who may have been in contact.
Yeah, we also read, one of the researchers who discovered the Ebola virus more than 30 years ago now has come out with an interview saying that he'd happily sit next to an infected person on a train.
Well, I would not want to sit next to someone who is infected on a train, but his point is a good one. This is not infectious in the way that the flu is or measles is, spreading through the air. You see these suits and you think it's highly contagious, but the reason you wear the suit is that there's no vaccine to protect you and there's no treatment if you were to get it, and it's highly deadly. This is not spread except through close contact with body fluids or with surfaces that have been contaminated.